So your doctor prescribed prednisone 10 milligrams. You might want to know, what should I do about it? I'm Dr. Megan, your prednisone pharmacist. And in this video, I'm going to go through, is prednisone 10 milligrams a high or a low dose? Is it strong? How you should take it and when to avoid side effects? Which side effects to expect from prednisone 10 milligrams? Plus, at the end, I'll include a free printable taper chart to help you figure out how to get off of prednisone 10 milligrams. First of all, the most important thing to know is how to take prednisone 10 milligrams. That's probably why you're here. If you were given a prescription for prednisone 10 milligrams, you want to know, how do I take it, right? Well, I made a video all about that topic, and you should check that out for more in-depth, precision way of how to take it. But basically, the most important thing to know is take it in the morning. Most people take it with food. So if you do that, that's the best way to do it. But you probably want to know more about that. For example, can you cut it in half? Can you cut prednisone 10 milligrams in half? And yes, often doctors prescribe prednisone 10 milligrams, and you could take any range of 2.5 to 50 milligrams based on a prednisone 10 milligram prescription. So what you could do is your doctor could give you a bottle that has 10 milligram tablets in it, and they could say, take 5 a day. So you would take all 5 at once, first thing in the morning, and that would get you 10 times 5 is 50 milligrams for that day. Or if your doctor says, take 20 milligrams of prednisone, but you have the 10 milligram tablets. So what do? You take 2 of the 10 milligram tablets, and that equals 20 milligrams for that day. And so a doctor might start out with, say, 5 tablets a day. The next day, they might go to 4, and then 3, and then 2, and then 1. That's a pretty common 5-day prednisone taper of 10 milligrams. And that's one way to do it. But guess what? A doctor can prescribe it any way. They could even start out at 20 milligrams, the next day, say 15 milligrams. And if that's what they're doing, then what they're asking you to do is take 1 full prednisone 10 milligram tablet plus a half prednisone tablet. You just split it in half, just snap it, or buy a pill cutter to cut it. You can even use a butter knife. It's not as precise, but you can do that. They usually have a little line in the middle. It's usually scored, and you can just snap it with your fingers. And that would get you 15 milligrams a day. Then they might take you to just 1 tablet of 10 milligrams a day. And then they might have you split that one in half, so that you'd be taking 5 milligrams a day. And some doctors are expecting a lot out of you and have you split the half in half to get a fourth of a tablet, which would be 2.5 milligrams of prednisone. They might ask you to do that. Often at that point, they prescribe 5 milligram tablets because prednisone is available as 1 milligram, 2.5 milligrams, 5 milligrams, 10 milligrams, 20 milligrams, and 50 milligram tablets. Your doctor could prescribe any combination of those and expect you to take them for any length of time. So if you ever have a question about this, definitely talk to your pharmacist, somebody like me, or your doctor, because they have access to the accurate information about what you should be taking. Those are some possible prednisone 10 milligram tapers you could do. There's literally an infinite possibility of ways to take prednisone 10 milligrams. So definitely talk to your doctor. So you might be wondering, okay, I was prescribed prednisone 10 milligrams. What is it used for? Now, it could be used for, again, an infinite number of situations. Generally, since prednisone 10 milligrams is a steroid, it is used, a corticosteroid, a glucocorticoid, for inflammation. If you have a disease that ends in itis, I-T-I-S, like rheumatoid arthritis or pneumonitis or neuritis, anything that ends in the itis, that's inflammation, and that could be why your doctor is prescribing it. Some common reasons include rheumatoid arthritis, asthma, poison ivy, a rash. There's lots of options, but generally it's something where there's like redness, swelling, pain, and your doctor has decided that the side effects of this are not as bad as whatever you're going through. So you might be wondering, is this a high dose or not? And there's a company called ClinCalc online, and they analyze prescription drug claims in the United States to decide what is trending, what is happening in the United States as far as what doctors are prescribing, what people are picking up from their pharmacy. And they've compared what people are taking when it comes to prednisone. You can check it out on their website. They have a little pie chart of what length of time people are being prescribed prednisone. And on here, it shows 5 days supply is pretty common. About a third of the time, a 5-day supply is all people are needing. That's all their doctor thinks they need. And then it could go to a 90-day supply, or people can be on this for life. It's really dependent on your condition, what else is going on, what other medications you're taking, and it's between you and your doctor, but anywhere between 3 days to 365 days could be a possible prescription length. And is 10 milligrams normal, high, or low? When they looked at this database, they showed that prednisone 10 milligrams was the most commonly prescribed tablet strength of prednisone, and it came in at 30.6%. The next most common strength of prednisone is the 20 milligrams tablets that are prescribed just barely less at 29.3%. And then nearly in a virtual three-way tie, we're talking prednisone 5 milligram tablets, and they came in at 27.9%. So basically, doctors are prescribing 5, 10, or 20 milligram tablets about the same amount of time, but prednisone 10 milligram is in for the win. Then you're wondering, that doesn't add up to 100. You could be prescribed 1 milligram tablets at 6.2%, or 50 or 2.5 or something else, or a compounded tablet capsule or powder, and that's another 6% of the time. That's what's prescribed. So prednisone 10 milligrams is the most common dose of prednisone that is prescribed in the United States at this time. And a 5-day supply is the most common length of time, but it could be any length of time. So is it high? Prednisone 10 milligrams is not generally recognized as a high dose. It's generally a average median dose, because you saw we had 5 and we had 20. So 5 is usually considered a low dose. Our bodies naturally secrete a hormone called cortisol that prednisone is mimicking, and our bodies naturally make about the equivalent of 2.5 milligrams of prednisone. And so that's what your natural is 2.5. 5 is double that, and 10 is double that. So you're basically taking, when you take prednisone 10 milligrams, 4 times what your body normally makes in a day, which is to be expected because your doctor's trying to give you the advantage in some inflammatory situation. So now you know that prednisone 10 milligrams is not usually really high. It's not really low. It's kind of low-ish. Usually high is 20 milligrams and above, but the definition of whether it's a high dose or a low dose is debated in the literature, and every scientist who's publishing an article defines it however they want. So generally, 10 milligrams is low-ish, and 20 milligrams and above is high. 40 milligrams is super high. I was talking to a guy last week. He took 625 milligrams, and that's called an ultra high, nuclear bomb option. That's the highest dose I've ever heard of. If you've taken more than that, please comment below. I'd love to know. But basically, it could be any of the range of 1 milligrams to 1,000 milligrams, but that's completely not normal. It's usually between 1 to 20 milligrams. 40 milligrams can be pretty common, 60 milligrams. But beyond 60 milligrams, it's incredibly rare. So you might be wondering what side effects to expect from prednisone 10 milligrams. If your doctor prescribed it, you're like, what side effects could I be expecting? So the typical prednisone side effects are worse the higher the dose, and generally get better the lower the dose. So one of the most common side effects is called moon face, where your face gets round like the moon because of fat redistribution in your body. And generally, this is going away or not very common at prednisone 10 milligrams. The higher the dose, the more common the prednisone 10 milligrams. So you're more likely to get it at 20, 40, or 60 milligrams, and not necessarily at 10 milligrams, but you can get it, especially if you've been on it for a long time. Other things that are related to moon phase include Cushing's syndrome side effects, and that includes weight gain, especially in the belly, high blood sugar, just this full-on fat redistribution. You could get fat on the back of your neck, and then muscle loss. So basically you're stealing from your arms and legs and moving it to your torso, gut, neck area. Not pretty, not fun. I went through it. I totally understand. Other side effects that the 5 most common prescription drug databases mentioned as low dose. I have a full blog all about this. You should check it out, but I'll just mention them. Include cataracts. So that's in your eyeballs. It can lead to blindness, heart failure, and other heart disease issues. The longer you're on prednisone, the higher the dose, the more heart complications you can get. Mood swings are possible at prednisone 10 milligrams. Usually it's more along the lines of depression and like sadness, whereas the higher the dose, the more it's more excitability, anxiety, mania, possible psychosis. The higher the dose, the more likely those side effects are. Changes in skin. So you can have skin thinning, you can have redness and flushing, which I had, and then changes in hair. You might lose hair or you might grow hair. Those are possible side effects of prednisone 10 milligrams. Although there are up to 150 side effects of prednisone you should check out. I have a whole blog post. In fact, I have a searchable list of prednisone side effects that you can go through and see, is this coming from prednisone or is this something totally different? So check that out. And then finally, people want to know how to taper off prednisone 10 milligrams. So if you were prescribed prednisone 10 milligrams and you're taking it for less than 10 and possibly up to 14 days, you generally don't have to taper in the traditional sense of the word. You just follow your doctor's prescription, and that generally either has a built-in taper or your doctor doesn't find it necessary. There are exceptions to this. Some people really can't handle not tapering, but most people's HPA, that's hypothalamic pituitary adrenal axis, can recover if the length of treatment is between 10 and 14 days or less. When you go beyond that, then a taper becomes necessary. And what is tapering? It's where you're stepping down in dose slowly over time. So you might have started at 10 milligrams. You might go down to 7.5, down to 5, down to 2.5, and then off at 0. And you could do that over a period of days or weeks or months. And I have a full list of possible tapers, whether it's the day long, like a few days, a few months, or even the dead slow and nearly stop taper that is for people who really need an extended taper. So check out that prednisone taper chart. You can download it for free to help you while you're taking prednisone 10 milligrams. I'm Dr. Megan, your prednisone pharmacist, and I'm here to help you not just survive prednisone, but thrive while on prednisone. Bye.